Welcome back to another Level Up Health video. In this video, we're going over what happens to your body when you quit alcohol. But before we get started, make sure you're subscribed to the channel as I'm always dropping new and exciting content to better your health. Thanks guys. Let's get started. Whatever your alcohol intake, whether you only indulge in a single celebratory Friday night drink or pour yourself an Olivia Pope-sized glass of wine every single night, there are a bevy of benefits to going booze-free. You already know many of them: weight loss, better sleep, and a happier, healthier mood. But what exactly happens inside your body that makes saying sayonara to alcohol so great? Alcohol is a toxin. As it enters the bloodstream, it impacts every organ system and takes a toll on the normal processes of the human body. So if you stop drinking, then your body doesn't have to go through that recovery process the next day. So let's count down what happens to your body when you stop drinking, on the outside and the inside. Number 10, your cancer risk goes down. When you drink, your body breaks the alcohol down into a chemical called acetaldehyde. This chemical damages your DNA and it prevents your body from repairing it. Your DNA acts like a set of instructions for your cells. It controls their function and growth. When it is damaged, the cells of your body can start to grow out of control. Sometimes this results in cancer. The National Toxicology Program of the U.S. Department of Health and Human Services confirms that alcohol can cause cancer. It lists it as a known carcinogen, and it has a lot of evidence for doing so. The risk tends to increase depending on how much time a person spends drinking and how long they drink. In fact, even people who are considered to be light drinkers have an increased risk of being diagnosed with this disease. Number 9, you'll lose weight. If you've ever gone even a week without your favorite cocktail, you'll likely notice your clothing fits a little more loosely. That's because when you cut out alcohol's empty calories, your body can focus on burning the other calories you consume. Alcohol contains empty calories, which don't offer nutrients. Those empty calories aren't as satisfying as energy from whole foods with nutrients like protein and fiber and fat, so you're likely adding alcohol's calories on top of your nutritional needs. If you eat an adequate amount to maintain your weight, any excess calories will be stored as fat. It's true that most drinks only pack 100 to 200 calories per serving, but that adds up. Though no longer considered an exact measure, 3,500 calories translate to approximately 1 pound of weight. So by simply eliminating nightly cocktails or weekend binges, you can potentially shed a couple of pounds by month's end. Number 8, you'll get sick less. Do you find yourself prone to head colds? Your nightly glass, or 3, of wine could be to blame. While light to moderate drinking shouldn't increase your susceptibility, even a single episode of binge drinking can lead to exertion on the immune system and cause inflammation, a common cause of many ailments. When you refrain from drinking in excess, you reduce and reverse inflammation, and because of that over time, your immune system will strengthen. Number 7, better sex. Alcohol can make us less inhibited, but anything more than a drink or so a day may have the opposite effect, especially if you abuse it or develop a dependency. As Shakespeare said, it provokes the desire but takes away the performance. Men might have trouble getting and keeping an erection. Women, their sex drive might drop. Cut down on the booze and see if it stirs up the romance. Number 6, you'll stay more hydrated. Alcohol is a diuretic, meaning that it increases the rate at which you expel water from your body as urine. The need to go or not go to the bathroom begins in your brain. As your pituitary gland releases antidiuretic hormone, or ADH, that tells your kidneys it's time to retain water. Drinking even small amounts of alcohol can have a temporary diuretic effect. Alcohol causes ADH levels to drop, and as a result, the kidneys produce more urine and retain less water. When you stop drinking alcohol, you restore ADH levels to their natural state and your kidneys expel the appropriate amount of water. By retaining water and staying hydrated, your whole body will feel better. Our bodies are entirely dependent on water. Every cell in our body uses water one way or another. It's essential for circulation, maintaining body temperature, and helps to get rid of waste. Without proper hydration, The heart must work harder to pump the same amount of blood, and your kidneys will eventually start to fail. Number 5. Your skin will look better. Another plus to rehydrating your body is that your appearance may improve. Though moderate drinking may not present a large number of immediate life-threatening concerns, it can quickly take a noticeable toll on your appearance, even after one night of overindulging. Less water in the body leads to some immediate and visible effects, including dry and more wrinkled skin, red cheeks, eczema, and bloodshot eyes. But take a night or a month off from drinking, and you'll likely be happier with what you see in the mirror. With the avoidance of alcohol and proper hydration, your skin should soon return to its normal, healthy state. Number 4. You'll feel less anxious. You likely already know that alcohol is a depressant. As such, alcohol directly affects the brain and its neural networks, impacting almost every one of the brain's processes. A healthy brain that isn't impaired by alcohol maintains a balance of neurotransmitters like GABA and dopamine. On the other hand, alcohol throws off the levels of neurotransmitters that regulate emotions and behavior and control cognitive abilities. When you drink, your GABA and dopamine levels deplete, and you may feel tired, anxious, and depressed when the intoxicating effects of alcohol wear off. But taking a break from alcohol allows your brain to restore the balance of feel-good hormones. Number 3. Psychological benefits. Alcohol usage goes hand in hand with some very common mental health conditions like depression and anxiety. And the combination of alcohol misuse and depression increase the risk of suicidal behavior. It can also affect the efficacy of antidepressant medication, so it makes a lot of sense to take alcohol out of the equation if you're experiencing these kinds of issues. The National Drug Research Institute saw that when they tested the Daybreak app, they monitored nearly 300 people who reduced their drinking by an average of 50% over 3 months. The K-10 measurement of psychological distress showed a reduction from mild to moderate distress at the start to low distress over that period. Alcohol dependence can make it harder to think or remember things. Over time, heavy drinking can cloud your perception of distances and volumes, or slow and impair your motor skills. It can even make it harder for you to read other people's emotions, but if you quit, your brain seems to be able to regain some of these abilities. Number 2. Your heart gets healthier. You might have heard that a regular glass of red wine is good for your heart. In fact, the jury is still out on that one, and if it's true, then it's only true for very light drinkers, which would be considered less than 1 standard drink a day. Increasing the dose certainly doesn't increase the effect in this case. If you drink more than that, you increase your blood pressure, levels of fat called triglycerides, and chances of heart failure. If your blood pressure is too high, you might be able to bring it down by doing one simple thing: giving up alcohol. Even just moderating your intake can help. It may not reduce your blood pressure enough though, so it's best to talk to your doctor about this and other things that you can do to help yourself. Number 1. Improved liver and digestion. The liver is responsible for cleansing the body of toxins, including alcohol. When you take alcohol out of the equation, the liver doesn't have to deal with metabolizing ethanol and can focus on being the body's filter for other toxins that we naturally encounter. Drinking too much can also cause fatty liver disease, inflammation of the liver, and, over time, cirrhosis and liver failure. Be sure to talk to your doctor if you're taking any medications. Some medicines interact with alcohol and can increase the risk of liver damage from drinking. Plus, our digestive system deals with alcohol differently than other toxins. Alcohol, particularly fermented beverages like beer and wine, can cause stomach cells to overproduce gastric acid, which can irritate the stomach. Excessive alcohol intake can damage the lining of the GI tract as well. As soon as alcohol enters the body and travels into the esophagus, it's already doing damage to the cells that digest our food. Studies show that it continues to affect the digestive system as it enters the stomach, where it can negatively affect the lining of the stomach and cause ulcers in the gastrointestinal tract. While you likely wouldn't see these effects with moderate alcohol consumption, stopping drinking eliminates the risk entirely. That's it for today's video on what happens to your body when you quit alcohol. Hopefully you enjoyed the video, and if you did, please hit that like button and don't forget to subscribe as it helps the channel grow. which is always appreciated. Thanks guys, and I'll see you in the next video.